Today we're going to talk about epidural steroid injections, what they are, why we use them, and how they help. My name is Mark Musson. I'm an interventional pain physician. Often we see patients with lower back injuries that also have pain radiating down the leg. These patients typically have had back pain for many years, but recently have had a flare-up or a specific event that then resulted in pain radiating down the leg. One opinion that goes along with this is sometimes folks will have minor back injuries over the years from lifting or trauma, and this leads to a little bit of an injury with the ligaments, creating some instability at a certain lumbar segment. So with that and with time, that can lead to more wear and tear in the disc and allow for a disc herniation or a more significant injury to the disc. So then as the disc herniates out, the disc material will sometimes compress or irritate the nerve root at that level, causing pain radiating down the leg. This is known as radiculitis or radiculopathy and is often referred to as sciatica. If symptoms don't improve with time, medications, physical therapy, often patients end up seeing someone like me and will talk about different treatments or more aggressive treatments, like an epidural steroid injection. And usually by this time they have an MRI, if not we'll obtain one so we can have more information of where the disc herniation is or where the specific problem is. If there's significant weakness with the nerve compression and there's concern for nerve damage, often we'll send the patient to see neurosurgery so they can decompress that nerve and prevent or minimize long-term nerve damage. So when we do these epidural steroid injections, we do them under x-ray guidance so we can be sure we're placing the medication exactly where we want it. We inject a combination of medication with a steroid and an anesthetic. The steroid is a very potent anti-inflammatory. The anesthetic numbs the nerve temporarily. So typically the numbing kicks in right away and there's some initial pain relief. Sometimes they even get a little bit of a weak leg or numb leg, and that'll wear off after a couple hours. The steroids typically take effect after a few days, and sometimes take up to a couple weeks to take full effect. One important thing to think about as we're doing these injections is the steroid is not necessarily fixing or healing the problem spot. Really, we're just trying to knock out the pain so the patient can get back to some of their regular activities, continue with their physical therapy, and hopefully with a little bit of time, things just cool off on their own. These injections can also be used for severe spinal canal stenosis. Success rate for these procedures with that condition is more like 50-50. If patients want to avoid the risks associated with corticosteroids, or if there's high risk for compression fractures, or if they've had a prior vertebral compression fracture, then often we want to avoid corticosteroids. Then we may opt for something like platelet-rich plasma. The nice thing about platelet-rich plasma, or PRP, is we can also use it to inject the discs and the associated ligaments as well. Make sure to subscribe so we can continue to give you good information to guide you on your pain journey. Until next time.